Hi, this is Kevin Zeblin, and I'm providing my reflections and trying to put it all together for Nursing 685, which is philosophical and theoretical basis for clinical scholarship and practice. My perspective about theory and philosophy has obviously changed over the length of this course. I previously knew very little about theories and philosophy, actually, and the use of it in nursing was very limited. I was using it more in an administrative role than in a clinical role. So it was exciting to be exposed to ways that was very pertinent to clinical and implementation of evidence-based practice. Um, that was very surprising to me. I knew that this was part of our curriculum for the DNP, but I didn't really understand why it was. And now I have a much better grasp of that. So the only time in my career that I needed to know nursing theory was, like I said, back in the 70s and probably in the 80s when I did my baccalaureate, and you would write out care plans. At the time, as a novice or relatively new nurse, the first 10 years of practice, I didn't appreciate what a care plan was. Again, common sense. Well, it's not common sense, especially for consistency. In a hospital setting or home health setting, many settings, there are different shifts that involve nursing care. There are different providers that are involved in that. Now I see the value of the nursing care plan, and I also see the value of some of the theories that we use to form those care plans. Prior to this class, I really just thought that was an academic activity that was meant to stir in our minds all the different items we wanted to take care of with the patient. I didn't think of there being a basis to it. My past experience with theory had to do when I was in nursing administration, so I knew Deming and Taylor and Lewin. But as far as nursing theory, I didn't really recognize them. I did not know them. And so to look at a theory now that can help me in a change of my practice or even a larger change within multiple practices, it's pretty exciting. The theory allows a step-by-step process that will lead you to success, and it helps you analyze what problems are there and why. So we're not producing workarounds, we're actually solving problems, and we're introducing a more evidence-based practice. The value of this class, I don't think can be understated. Prior to taking it, I was pretty intimidated about what might be involved in it. I wasn't sure exactly what we would do with theories or philosophies. The idea that we were exposed to some very helpful theories, very purposeful, valuable ones, as well as the discussion boards that we had so that there was an interaction between my colleagues and myself, that was very helpful. For me, to hear someone or to read someone's writings about using a theory to work with obesity within their practice or to improve success of lactation, to consider what it would take for cultural competency and looking at that in a theory, that brought home how valuable these theories are to our clinical practice. They are not just books on the wall that will gather dust. That's the first time in this program that I felt that way. I think that this class was very valuable as I go into prepare my project. I do that this summer. Well, I've got all the pieces now. I understand a theory that I will use or model, and that will probably change once my committee people, my advisors, find a different one they like more, and that's fine. because I really see the value of what a theory can bring to a project or to a change. The idea that it's very systematic, it's set for success. If you don't achieve it on this, you can step back and reassess and then go forward. I love the idea of no workarounds. We have done that as nurses for decades. If somebody tells us to hop through the hoop, and you know what, we can't make it through the hoop because of all of these barriers, well, we just pretend we're hopping. So now it's really great that no, we have tools to really accomplish these things. I would like to say how much I value my colleagues. This was such a great environment for learning. It was a very positive one. If you weren't quite sure when you were posting something, if you said it right or if it was going to be pertinent, everyone was very positive about it, encouraging. It was very nice. Unfortunately, in the program up to date, that's not always been there. I think we've all been so overwhelmed we haven't had a chance to be encouraging, and it was great to see the interactions and to feel the benefit of that. What is one item that will impact my personal practice? Just the whole idea that there are theories out there to support our practice and to encourage evidence-based practice and or the implementation of that. There's lots of research on the evidence-based, but how to get it there and how to do it without workarounds and dragging people along with you to try and do it once so that hopefully then you're on to the next thing. However, I'd like to really draw attention to our favorite two superheroes. I'm sorry I couldn't find him with dark hair, but that would be Dr. Burgess and Dr. Griggs. I appreciate so much the hard work you put into this class, the rewriting of it, the reformulating it so that it was very pertinent. There was lots of reading, but it was pertinent and relevant. It was not busy work. I'm too old for busy work. This was wonderful. It was also, like I said, a very safe environment, very encouraging environment to learn in. As a DNP student, I think sometimes that encouragement isn't there. In the clinical aspect, people don't really understand why you're going for your doctorate when it's not going to change your job, per se. They just think, I've had patients or people tell me that I just want to be a doctor and I'm not going to be, and, that kind of foolishness. But in this class, you guys treated us like colleagues and helped us really grasp this and value it, and kept us challenged with assignments that made a difference. Like I said, I'm ready for my DNP project now. Am I ready as far as my lit review? No, I got plenty of stuff to do before my Squires is completed. But I'm ready because I feel like I've got all the pieces, and this was the final piece, and it is great. So I applaud my two favorite superheroes for doing what they did for us, that this was a very good class and a very meaningful class, and I appreciate that. Thank you very much.